Now we continue our journey by confronting ethnic disparities in healthcare.
Our own Treasure Roberts shares why doctors say black women are at a higher risk of dying during childbirth.
Madison Duncan, Peoria-born, now living her purpose as a nurse at Emory University Hospital in Atlanta.
I wanted to be just like her, so that's really what motivated me with the nursing.
She was inspired by her mother, Roxana Duncan, a nurse at a hospital in Peoria. Madison says her mom's legacy still lingers.
I just heard great things about my mom. Like, they're all like, that smile just brighten up the room. And just seeing like old nurses she worked with. I just remember one nurse just telling me like, oh, my heart is just so warm seeing you. It just reminded me of her. So I just seen like she made that impact on a lot of people.
Madison grasping tight to stories she'd heard about her mom growing up, coping with the fact that she'll never again experience her love. Madison's date of birth was the day her mom died. Roxana's father, Chris Duncan, says on September 30, 1996, he was angry with himself. While he was working, his daughter was in a hospital bed clinging to life.
And then I got a call at work that she's bleeding out. I need to get back to the hospital.
I remember my grandma telling me remember my mom having like her nose bleeding and blood coming out the ears, and then that's when everything changed.
Roxana's family says she was 26 and healthy. Her death caught them off guard.
She had no looks of any, no illness that we were aware of. And so when she comes into the hospital alive to have a baby, I don't anticipate 12 hours later she's going to be dead.
According to the Center for Disease Control and Prevention, approximately 700 women die from pregnancy-related complications in the United States annually. CDC data shows black women are 3 to 4 times more likely to die during labor than white women.
There's a lot of disparity when you compare the rate of chronic diseases among black women compared to their non-black counterparts. Some of the studies that we have seen, women presenting to the emergency room during pregnancy or after childbirth with pain, and doctors looking at them as if they're just seeking pain medications rather than looking at them as maybe this pain is real.
Central Illinois doctors are also monitoring the stats.
When we see that the rate of death among black women is 4 times, in the state of Illinois it's actually 6 times compared to white women. So that is horrible.
Other health experts like Anna Langer, a professor with Harvard T.H. Chan School of Public Health, says this is a public health and human rights emergency because estimates show a significant portion of these deaths could have been prevented. Working her way up the medical ladder, Madison says she thinks listening to patients' concerns is key.
I feel like we know what's going on with our body the most, and versus doctors kind of act off what the book says and not just listening to that patient. Because just listening to that patient, you can be able to help them in a heartbeat.
The medical school curriculum, the residency teaching that we have, and even physicians having continued medical education about diversity and inclusion, cultural competency, implicit bias programs for us to understand those biases that we have and how to provide competent care.
Madison, giving patients the care she says she wishes her mom received, carries a reminder with her every day.
As long as you're in my hands, then not on my watch. I'm doing anything I can to make sure that you are safe.
The Duncan family acknowledging the gaping hole in their hearts, but certain Roxana's death prepared Madison for her destiny.